welcome. I am Dolores White, and I have the pleasure of serving as the president for the KNA. Thank you all for attending the KNA Town Hall tonight, and to the Heartland and Green River chapters for hosting this event. Thank you to the Governmental Affairs Cabinet for planning and holding the town halls this month across the state. And thank you to the KNA staff for all the behind-the-scenes work to organize and implement the event tonight. And tonight it's Delano and Kim here. And a special thank you to all of the legislators and legislative candidates here tonight. We truly appreciate you attending and for your support. The KNA represents and speaks for 90,000 voting Kentucky nurses who make up 53.3% of the healthcare workforce. We encourage you to please contact us at any time if you need information or assistance. We're happy to serve as a resource for you when you have health and healthcare questions and as you are planning legislative actions. Truly, we are here for you and we'll be happy to assist and again serve as a resource for you. Now I would like to introduce the KNA CEO, Delano Manson, who will review the agenda and the guidelines for the evening.
Good evening, everyone. Again, the same as from Dolores, but welcome to the KNA Town Hall. This is our second of 4. You'll have an opportunity to introduce yourselves, and you'll have 3 minutes to do that. So tell us a little bit about yourself and why you're running for office. And I have the magic pen. When I hold up the magic pen, you have 15 seconds left. If you go past your 15 seconds, I will turn off your mic and say, I'm sorry. And as we go through the town halls, you'll be asked questions and you'll have 3 minutes to answer those questions. And the magic pen will come again 15 seconds before your time is up. So we're going to go around and do introductions in a little bit. And then April's going to talk a little bit about the Kentucky Nurses Association, what we stand for, and some of our priorities. And then we're going to have questions and answers, and you'll get an opportunity to tell us more about yourself and how you feel about nurses and our issues. So why don't we start with introductions? Dolores already introduced herself. Jamie, would you introduce yourself?
Yes, ma'am. My name is Jamie Skudlarick. I'm running for State Senate District 5. I have a bachelor's in biology, a master's in aquaculture, a PhD in food science. I grew up in Southern Indiana and then moved to Kentucky for school, met my husband here, and we just kind of stayed in Kentucky. We lived in Frankfort for about 8 years and then moved over to Ohio County, bought a farm down here, and we've lived here for about 9 years and really enjoy it down here. The reason why I'm running for office is basically nobody else was running against my opponents. I decided to file and run myself. That and I want my women's rights back.
Okay, John?
How are y'all doing tonight? Thank you for having me here. My name is John Whipple. I am a retired Army Sergeant First Class. I did 23 years in the military. Met my wife when I was stationed at Fort Knox, and we decided to retire this way out here. While I was in the military, I picked up my bachelor's degree, and when I retired, I transitioned into through the Troops to Teachers program and became a public school teacher. And I taught primarily eighth grade social studies for 19 years. And in that time, that was when the last couple of years, especially with Governor Bevin, when I felt that as a part of KEA especially, that the state legislature not only was passing bad laws against education, they were passing bad laws for teachers, and a lot of it was aimed at me as a member of KEA. And I tried to run in 2020, but COVID shut me down. And last year when I decided to run again, I couldn't teach and run for office at the same time. So I retired from teaching strictly so I could focus on the campaign. My primary issues are public education, labor. I'm very interested in public health. I think that I'm a CASA volunteer, and I see problems that students have all the time and how it affects their lives. So I'm really interested in making sure that the kids get the proper health care. And a lot of that has to do with education because teachers, they're not even allowed to discuss health issues with kids, the public, or what do they call it? Phys ed teachers. So that's my interest. And again, thank you for having me here.
Okay, April.
Hi, I'm April Hester. I am a nurse anesthetist where I currently serve as a co-chair to the Governmental Affairs Cabinet within the Kentucky Nurses Association, and I will also be one of your moderators this afternoon.
Thank you. Tyler?
Hi, everyone. My name is Tyler Chapman, and I am running for state representative in House District 27, which is Meade and Hardin County. I first want to say that thank you all for being here tonight. Nurses hold a very special place in my heart. My partner is a nurse. My mother is a nurse. My aunt is a nurse. And I have many friends and family that work in healthcare alongside them. So I appreciate immensely the work that you do. I grew up on my family's farm in Ekron, Kentucky. And on that farm, that's where I learned the value of hard work, honesty, and looking out for your neighbor. And those are values that guided me through my entire life, through my career in banking and now into this campaign. And in my career, I made it my mission to make sure that I take complicated problems and break them down into easy solutions for folks. And that's exactly what I intend to do in Frankfort. I think that our government should be straightforward, transparent, and mostly work for all of us, not just a few. I decided to run for state representative for many reasons, but mostly I see a lacking and a need in our own community. I think we need a representative who understands our community, who will fight for clean water, safe roads, and our kids' education. A representative who will fight to lower costs on food and fuel, healthcare, and all of these things that affect our daily lives. And most importantly, a representative who will fight for reproductive freedom, because we know that is critical to healthcare. So again, thank you for having me tonight, and I look forward to the rest of the panel.
Thank you, Tyler. Sherilyn.
Hi, I'm Sherilyn Smith. I am running for state representative in District 25. My opponent is on this call tonight, which is on your KNA association, but I am running simply because, and I will go back who I am in a minute, but I am running simply because District 25 is actually missing a lot of things. It's skipped over, and it's no fault to my opponent, but they're missing a lot of things because the district is caught in a growing situation right now. Hardin County is in a massive growing period, but they're stuck in a past situation. But Hardin County needs someone that is more progressive to the needs of people that does not understand the 3 levels of ledge. And that's what I'm running into. We have the uneducated of law, and we are hurting in those departments. We are lacking in transportation. We are lacking in health. We are lacking in education within this whole. Hardin County needs someone that is going to fight for them altogether, not just for tourism, not just for the growth of the area, but the growth of economics. Economic growth is what they're needing. We can make $20 an hour, but they're still going to the soup kitchen. We're looking for someone to put forth more of a growth in jobs and growth in education. I was brought to the area 20 years ago via military. I worked in drug and alcohol. I was a drug and alcohol manager. Prior to that, I worked in budget. I worked in budget for 6 years for the military. I worked for the military for 22 years. 3 years ago, I worked for COT, which is Commonwealth Technology, before this position that I am running for now, which is state representative.
Thank you, Sherilyn.
Yes, ma'am.
Steve, would you introduce yourself? Tell us a little bit.
Yes, ma'am. My name's Steve Bratcher. I'm running for House of Representatives in District 25. I'm currently in the seat now. I was born and raised and educated and worked in Kentucky. I was born in Louisville, and then I achieved my undergrad and master's degree at Eastern Kentucky University, and then went back, got an MBA at Bellarmine University. I've served in the Air Force or National Guard for about 30 years. So 30 years now. And so I'm actually down in Kirkland Air Force Base right now doing some training. So I'm having to zoom in from there. But I've also served on the House Health Committee where we've passed several laws that have supported and helped nurses. And I think we've worked with the Nursing Association on getting some of those passed. So I also own an assisted living facility where we deal with nurses, and I'm very aware and very concerned about the nursing shortage that we have in Kentucky now and where that's going. And we need to put some more things in place to reduce that gap. So I work at Elizabethtown Community College in the workforce solutions. So I create and develop programs that not the academic side, but the business side of the house. We've worked with several hospitals, including Baptist Health, Heartland, to create some programs such as sterile tech programs and things like that for the medical industry. So I continue to serve on the board of directors at the Habitat for Humanity. So do serve and volunteer for Feeding America. So I'm very active in the community. Like I said, I'm born in Kentucky, raised in Kentucky, educated in Kentucky, and have served Kentucky through multiple nonprofit organizations, as well as the military, National Guard, and in the House of Representatives. So thank you. I appreciate your all's time tonight.
Thank you, Steve. Julie, would you introduce yourself?
Julie Denton. I am the external government affairs person for KNA, which means I'm their lobbyist.
And could you tell them why you're in DC at the Mayflower?
I am at the American Nurses Association lobbyist meeting. And so I have a really interesting wall behind me from my hotel room. I mean, it's pretty boring, but it is what it is.
Well, it sounds like they have a nice bar, and that's really important.
Great Diet Coke is all.
There you go. There you go. Joanne, would you please introduce yourself? And Jesse, I'll get to you last, but not last. But I mean, you're important. So Joanne, please introduce yourself.
Hi, I'm Joanne Ray, and I am the president-elect for the Kentucky Nurses Association. I take the helm, gosh, is it less than a month? Kind of makes me scared to say that, but I'm actually also packing to go to a conference. So
16 days.
16 days, and then I take office. So I'm very excited. And hopefully Delano will be my right hand for another at least 3 years, right?
Got it.
Thank you.
All right. Jesse, since you're our host for today, would you introduce yourself? Jesse is the chair for the Heartland chapter, and it looks like she's having a few technical difficulties. As we all know, when technical difficulties come, we just bow to it and keep on moving. All right, so now I am going to turn the program over to April, and she's going to tell you all a little bit about the KNA, and if we don't already know, we're in trouble.
First, I would just like to reiterate and say thank you guys for spending your afternoon and evening with us. We know you all are busy, and we really appreciate you being here. We hope this is helpful to you as well as the many KNA members that are here today. I think we had 46 members registered, which is a great turnout for the 2 chapters that we have. I'm sure you know there are nurses in every legislative district within our state, so some of your constituents are on tonight, and they're looking forward to hearing from you as well. Each year, the Kentucky Nurses Association works to improve not only nursing, but the overall healthcare within our state. We do this by volunteering, workforce data collection, the Nurse Emeritus program, collaborating with other healthcare and professional associations, as well as setting forth legislation for legislative priorities with you guys. The legislative priorities are based upon information review, sharing, evidence-based practice, research-based policy, and you guys, anyone can put forth proposed legislation to KNA. These priorities are brought forth to our attention not only by the aforementioned things, but any individual, whether it be a nurse, a legislator, or just a private citizen. Year-round, we accept requests for proposals for legislative priorities or concerns. There is a specific form that can be submitted via the KNA website, and it's found under the advocacy link on our website. Again, we appreciate the legislation for decriminalization of healthcare providers that was passed last year. Kentucky is the very first state to pioneer such legislation, and we are looking forward to seeing other states follow our lead this coming up sessions. In the 2023 session, the General Assembly passed House Bill 176, strengthening our policies to prevent workplace violence. Data shows how important this is. 48% of nurses reported an increase in workplace violence, and half of those showed injury from that reported violence. Thanks to the Kentucky legislature, we have become the 40th state to enact some form of workplace violence legislation. We applaud the General Assembly for increasing the safety for all healthcare providers within our great state, and we're working forward to address the nursing shortage, and we hope to do more work on this moving forward. As you know, Kentucky, as well as the entire U.S., has a critical nursing shortage at approximately 36%. Or to give another perspective, we are about 20,000 nurses short nationally in the year of 2025. KNA wants to continue to partner with the General Assembly to implement creative strategies to address those shortages. At this time, the KNA has 3 different legislative initiatives for the upcoming session. While we don't have specific legislation at this time, our goal is to shine a light as well as educate and speak to legislators about these issues. First, the overall healthcare workforce shortage within the Commonwealth. Secondly, school nurses. And third, the Sexual Assault Nurse Examiner, or SANES. You will find additional information on these topics in the town hall packet that you received prior to this town hall. Please know we will be sharing additional information in the very near future on all these priorities. KNA supports a number of other issues dealing with recruitment and retention, the Nurse Emeritus program, making the workforce place shortage safer and less stressful, and measures that would make nursing a more appealing career overall for others. We work not just with legislators on our priorities, but other provider associations and groups to collaborate on these solutions, like the Kentucky Health Association. We work, like I said, with several other associations. Now I'd like to give you guys the opportunity to share your thoughts on the issues that's important to Kentucky nurses. Our lobbyist, Julie Denton, and I will take turns asking questions, and each of you all will have 3 minutes to respond. Delanor will be our timekeeper. If you need any clarification, please let us know before you start speaking. I spoke briefly about SANES, or Sexual Assault Nurse Examiners. Would you support legislation to increase SANES in Kentucky? Also, would you support funding toward increasing SANES in Kentucky? Delanor, would you like to call each legislator out individually to speak?
Would be glad to. I want to start with Steve. Steve, is that okay?
Yes, that's great.
Thank you.
So there's several different things with the SANES, which is the sexual assault examiners. I think it's a multifaceted approach where there's first of all, there's not enough of them. Second of all, there's a geographic disparity between where we have them and where we don't have them. And thirdly, there's a backlog of how long it takes to process these kits. And so what happens is, I think, yes, we need to increase the funding. We need to increase the amount of, and maybe encourage some of these to go to areas that are in maybe the Appalachia area and some areas that we don't see them commonly. And we need to work with getting these processed a little more quickly. So the value is we can lose potential evidence by delay. And then we can also, the perpetrators, we need to be able to get them and arrest them as soon as possible so it doesn't happen again. So, like I said, I think there's 3 different elements to this, and it's something I will fully support, and I hope to see some legislation come about in this next session for it. So, thank you.
Thank you, Steve. Jamie?
Yes, I would support expanding legislation for SANES and funding. I would find some way to do it. It's absolutely important. Sexual assault is, something that doesn't need to be forgotten about or underfunded at all. It should be a top priority.
Tyler?
Yes. Well, I want to say, first and foremost, I fully support increasing the number of SANES in Kentucky and will absolutely advocate for the necessary funding to make that happen. I think that the fact that sexual assault victims may be turned away or sent away for hours due to shortages is absolutely unacceptable. I think that every emergency department in Kentucky should have access to SANES to make sure that victims receive the compassionate expert care that they need and that so justice can be served. And I'll take it a step further. I think that the General Assembly can do better and pass legislation to help prevent these sort of sexual assaults where folks don't have to experience it. I think if we can pass laws that help alleviate some of the pressures on the front end, then nurses and sexual assault nurse examiners won't have to feel the pressure on the back end.
Thank you, Tyler. John.
Yes, I fully support the rapid and the swift pursuit of any kind of information that could result in prosecution of sexual assault. But I think that's only part of the problem. One of the things we have to do is make sure that we find a way to reduce the stigma of the victims so that they're not afraid to come forward. It's really good when the ones that have the courage to come forward, that we have these assault kits that we can take care of them. But there's so many that are afraid to come forward, that don't have the courage to come forward. And we need to find, and this isn't just women. There's also men that are involved in sexual assault. And we need to make sure that that's addressed as well. So, yes, I would support fully. I would be committed to supporting the sexual assault kits, the distribution of them. But I also want to make sure that it's done in a compassionate and sensitive way so that people are not afraid when they've been victimized and when they've been abused.
Thank you, John. Sherilyn?
Yes, ma'am. Rape cakes. I fully support having rape kits. I'm gonna go a little bit further and deeper into this. Being a rape victim myself at 16 and having a daughter and with the rape victim, there was no kits available. So having funding and having people with training, less invasive questions, rape kits need to be available and everywhere. Once officers get involved, once everyone needs to be trained in this. It's imperative. It's definitely imperative. Mental training needs to be done with nurses because no one has that type of training to console someone in these type of situations. So definitely the funding, definitely the places where they're not kept. Rural areas don't have all of the equipment for rape kits, rape victims, and the mental training for it. So we need definitely extensive training for rape kits. Thank you.
Thank you, Sherilyn. Julie, I'm now going to turn it over to you to ask the second question.
Thanks, Eleanor. Well, the next question deals with nurses in schools. And while we only have, out of 171 districts, only 101% had a full-time nurse in all the schools, and 38 districts had a part-time nurse in 118 of their schools. And this is sad, but 25 of our districts had no nurse in 52 of their schools. So we have a goal of a nurse every day, all day long in every school. So our question deals with school nurses. And what are your thoughts regarding a full-time nurse in every school? And do you support funding assistance from the state back to school districts to help cover the cost? And the cost is less than $5 million a year if the state helps support a school nurse in every school all day, every day.
Jamie, I'm going to start with you this time.
I'm honestly surprised by this information, shocked, in fact. I didn't know that we have 52 schools in Kentucky that do not have any nurse at all. That's disappointing. I would definitely work to support a program or funding where we can, reach a goal of a full-time nurse in every school in Kentucky. I think that's an absolute need. Maybe I know that there's like a recruitment or a retention type issue with nurses. Maybe we could do some kind of coordination with nurses that want to leave a type of job that is more stressful to something. Well, I don't know that a school nurse isn't stressful, but you know what I mean? Like maybe there can be some kind of transition from a high-speed nursing type job in a hospital to like, maybe we could suggest that they might like a school atmosphere and try something like that out if you have a nurse that's set on maybe early retirement or just leaving the workforce period after being disgruntled or something like that. I would definitely work towards achieving the goal of a nurse in every school.
Thank you, Jamie. Charlotte.
Yes, ma'am. I definitely support in school. The same with Jamie. I did not know there was 52 schools out of in Kentucky without any nurses. Nurses are really critical with children that have asthma or any type of allergies. They are needed with EpiPens or so forth. With the state fundings, those type of emergency items that are needed, defibrillators are needed on time, nurses that are going to be there 24/7 for the just like resource officers that are there. There's a way to fund those nurses that can be there in the school 24/7 as the 9 months for the students are being in school. If we can fund resource officers, we can fund nurses. We can give them the adequate pay to be in the school without cutting them down from being in the hospital or any type of other facilities. They can be in the school districts just as the same with the same funding without cutting their pay with good pension.
Thank you, Cheryl. Tyler.
Yes, thank you for the question. I strongly believe that every school in Kentucky should have a full-time nurse on staff. I believe that they should be there every day, and I believe they should be there all day as long as students are there. I think the benefits are very clear. I think there's reduced absenteeism, there's better management of chronic illnesses, improved mental health outcomes for students. And on top of that, I do fully support making sure that there's funding assistance from the state to help school districts to cover these costs. I think that it's an investment in our children's health, and I think it's an investment in their well-being, and it's one that if we can invest in their health and well-being, that it will pay dividends in the long term.
Thank you, Tyler. Steve, what are your thoughts?
But I think that I agree. As a matter of fact, I've been working with the superintendents of our school districts, both of which have nurses in some of their schools, but not all of their schools. They've identified the schools that have the most need. And then sometimes a nurse will travel from one school to the other. Some of the things that they were looking at doing is partnering with healthcare facilities. So instead of the nurse being a direct hire through the school system, they may partner with Baptist Health, and Baptist Health may have a nurse there. And then what happens is I don't think that the $5 million, even though that's kind of a price that's out there, the nurses that are in the schools now, for example, Hardin County Schools has a nurse at their high school. When the person goes to the high school nurse, they bill their insurance, which is the way that the nurse gets, the association gets the revenue, or the unit that's providing the nurse gets the revenue, as well as that the Medicare or Medicaid, the ones that don't normally have access to nurses, can have a nurse. So I think this is vitally important to the development of our kids as they grow up, and that it reduces the spread of sickness, and the quicker we can address some of the illnesses, the minor illnesses that prevents them from becoming chronic. It also provides a path for those who may not have access. So there's some students may not be signed up for Medicare, and they may fall in the gap. And this would give them an opportunity to see a nurse or a medical professional and get some preventative treatment. So I support it. I think there's more ways to get there. And even though we are lacking in some schools, we have made big strides in the last 2 years. And I will continue to push for it and advocate for it until we get to 100%.
Thank you, Steve. John, question to you.
Thank you very much. As I said earlier, I'm a retired public school teacher. And when I was actively teaching, I was on the KNA board of directors, the statewide board of directors. And we always made sure that nurses as a part of the school staff were on our legislative agenda. And we actively lobbied the state legislature to push that issue. In the classroom, I want to tell you that it is vitally important. First off, our district, the school I taught in at the middle school, we shared the nurse with the high school next door. And even though it was a short 3-minute walk, that 3 minutes makes the difference between life and death in some cases. And thank goodness that we never had that situation. There were still times when it was an issue, that the how long it took for the nurse to get from one building to the next. I want to say that if the nurse is in the building, she gets a rapport with those students. She or he, the nurse gets a rapport with the students and understands them and knows their issues, knows their backgrounds. Tyler said earlier about the attendance, when instead of, when the student can go to the nurse instead of having to call mom, have mom or dad come pick the kid up, take him to the doctor, the nurse can say, oh no, that's okay. The nurse can make that decision. Here in Breckenridge County, we have our ACTC, and one of the strengths of our high school is the nursing program that they have there, where we're putting out all kinds of young men and women that are going to be in the medical profession in one way or another and end up being licensed nursing aides. And I think that one of the things that could help cost is to find a way to roll these graduates, these students with the training, so that they come back and actually participate in the schools that they've been trained in. So yes, this is something that needs to be funded. And it's like the SROs. The state legislature mandated that we had SROs in every building, but didn't fund it. And so the school districts had to find a way. Our school district pays $85,000 a year for 2 SROs. And they have to pay for the nurse on top of that. This shouldn't come out of district funds. This should come up from the state legislature. They have millions of dollars in surplus funds for the past couple of years. They can find a way to fund this. $5 million, especially when you're looking at the health of a student or a teacher. Because, when I was there, the nurse always, hey, John, how's your blood pressure? They knew they knew. So how's your blood pressure? And if I had, I said, hey, if I don't feel good, I'd go in and she'd take time to check my blood pressure. And where's your test kit, your diabetic test kit? And when's the last time you checked? You don't look too good. These nurses care. And all right, thank you.
Thank you, John. I appreciate that. April, will you ask the next question, please?
Yeah, but he brought up a very valid point. He brought up, we're always talking about school nurses and how it's beneficial to our students in education, but it's also beneficial to our teachers. So I just wanted to point that out. I really like that thought.
April, I wanted to point since you brought that up, I wanted to point out something else, and that is the school nurses in many cases, and I think it was Steve who said, they're in many cases are the only access a family has to healthcare.
Yeah.
And a school nurse also may be on the forefront of helping to diagnose something that parents don't know about yet. It's really unsafe to ask the school secretary to administer medication when they haven't been trained to do that. So we truly believe that a school nurse is essential to keeping students and teachers safe and healthy. Okay, I'll get off my soapbox. Go ahead, April.
I know, I kind of got on mine too. I couldn't help myself. So I am going to ask a question, and then Julie's going to ask a different question that revolves around the nursing shortage, okay? Based upon KNA's priorities of school nurses, the sexual assault nurses, and the nursing workforce, we want to take a moment to ask you guys if you all have any additional thoughts or questions for us. Eleanor, would you like to call upon the legislators?
Oh, of course. Oh, Jamie has an idea. Jamie, go right ahead.
I actually just have a question. I'm wondering, has Kentucky always had the nurse shortage in schools? Has this always been an issue, or is there somewhere along the line where it's just been, forgotten about in funding, or just kind of lax?
Well, I can tell you that when I was in junior high school, which is a long time ago, and high school, we had a school nurse, and it was really important to my personal health in that I had migraine headaches and a lot of allergy reactions. So I can say that a few years ago, there was school nurses in every school all day, every day, but that's been some time ago. What else do you all think that in terms of sane nurses and school nurses? What questions do you have of us so that we can be a resource? While you guys are thinking on that, I'm going to ask Dolores to say a little bit about the Nurse Legislator Engagement Program. And if you all have not been assigned a nurse to support you, now's the time to speak up and ask Dolores for some help. Dolores, we want to talk about your program briefly for a moment.
Absolutely. I'll make it very quickly. Thank you. The Nurse Legislator Engagement Program is where we are pairing KNA nurse members with legislators. We have 138 legislators in the state at state level, senators and representatives, and we currently have 86 of our members paired with legislators. And what this program is where we can build relationships with that particular legislator that we are paired with and serve as a resource, share our nursing expertise, knowledge, and experience, and share KNA information and data and statistics as we bring it forward. We can make sure that legislators have that. And then legislators have that key person within the KNA that they can contact anytime something comes up that you have questions that we can assist with. So we're working our way to get every legislator paired. A few still left to go. And if, you know, those of you in the legislative office shortly, we will work to get you paired if you're not already.
Thank you, Dolores. So do any of you have any other questions that we can answer for you on our topics, our priority topics?
Yes, ma'am. I do have a question.
Yes, John.
Yeah, I'm wondering if this nursing shortage has anything to do with the change in abortion laws in Kentucky. Are they more reluctant to enter the nursing field because they're afraid that they might have to provide care that could actually be considered illegal?
I can speak from personal experience, and then Delanor, you probably need to elaborate thereafter. I have always had the option to care. I'm a certified registered nurse and ethicist, and I've always had the option to either provide that care or not provide that care. It has never been forced upon me based upon beliefs, and that has been extended through to my coworkers as well. So that's my personal experience, and Delanor, I'll let you elaborate.
Well, I want to say that I have not heard from any nurses that are any nursing students or any students who are considering the nursing profession that the issue of not being able to provide women's health care is an issue that has forced them to go one way or the other. And Dolores, have you heard from any students or anything? Now, I have heard about nurses being more concerned about workplace violence and how they are going to protect themselves and what are they in for in their workplace. So workplace violence has been one of those subjects that people have been very concerned about. Also, staffing and looking at our nurses engaged in staffing decisions, our nurses at the table where the decisions are being made. So those types of issues have been front and center for nurses.
And Delanor, I'll just add in criminalization. The issues that we are bringing forward and working on in our bills that we've had the past couple of years, those are the concerns that nurses are bringing forward to us.
I mean, we have people from Tennessee who want to move to Kentucky. They want to work in Kentucky because they don't feel safe in Tennessee. And we've been doing consulting with other states about the decriminalization bill. Being the first in the country has provided Kentucky with some notoriety. And thank you, Julie, for all of that hard work. And thank you to the legislators who voted so that we could get that passed. That was hard. That was really hard. Thank you, John. That was a good question. Anybody else have a question? Okay. And Julie, I'm going to let you go on to the next question.
We have a question based upon once you're elected, and some of you may already be elected, but once you're elected, do you have personal legislative priorities that you've already decided upon? They don't have to be healthcare, but what are your personal legislative priorities once you get elected?
Okay, I'm going to start with Cheryl Lynn this time. She's never had a chance to be first, and so she's going to get to be first this time. Cheryl Lynn, priorities. Talk to us about your priorities.
My one is strengthening public education is my top
priority. Economic development is number 2. Healthcare access, public safety. I'm just going to run down it without going to give everybody a chance here. Affordable housing and homelessness. One of the growing issues that we do have in our area. Environmental stewardness. I do clean energy. I guess where we're going towards, of course, we have in our area, we have the growing plan of Blue Oval. Showing, one of my passionate things is showing the elder and the youth how to grow their own food. I work with the community garden. And so way things are going in the economy, I like to, and it actually feeds into a lot of different things. It feeds into mental health, working out, and togetherness for the community. I have bridged, and we just partner with the local Girl Scouts. So it's bringing in the young and the old, all together, community togetherness, and showing, you can grow the bees, dragonflies. I get excited when I have tree frogs and stuff like that. So bringing those type of things into the community and showing that you can grow where you live and you can eat what you grow. So those are the things that I like to show, and those are the things I like to bring. Some of my priorities once I'm elected. I like to be close into the community of my district, not just in Frankfort.
Okay.
Because my thing is, I'm for District 25, so I want to work within District 25 and not just, be within Frankfort, because District 25 is who got me elected.
Thank you, Cheryl Lynn. I
My
appreciate that.
You're welcome.
Tyler, what are your priorities?
Yes, so my legislative priorities are really centered around working families and protecting our public schools and public education, and also ensuring access to affordable healthcare, especially in rural areas like where I'm from. Specifically, I'm committed to restoring reproductive rights and protecting those reproductive freedoms in Kentucky. I think that it's crucial. I think that it's not only a matter of personal freedom, but it's also a healthcare issue that impacts an entire healthcare system across our state and across the country. I'm also committed to improving infrastructure in our area. Specifically in Meade County, there's 420 miles of roads without water, clean water. A lot of folks have to go get water put in their cisterns at the water company. And I think having access to water leads to healthier outcomes for folks. And also, of course, ensuring safer roads in our area. And lastly, making sure that healthcare is accessible and affordable. Prescription drugs are really high. We see interference with PBMs and how they like to take a bite out of what folks are having to already pay. And I want to make sure that we can increase access to healthcare, like I said, in rural areas, especially in means of like telehealth. I think that would really help areas like mine. But it's crucial in rural areas, and it leads to a healthier Kentucky. So those are just a few of my priorities.
Thank you, Tyler. Jamie, would you share with us?
Yes. Number 1, I would work to lift the abortion ban. That's just absolutely the most important thing to me. I do not think Kentucky can move forward without lifting the abortion ban. I think it's beneficial to the nursing industry as well to remove that ban. I would also remove the Don't Say Gay bill that they passed, the SB 150 that they passed last year. I think that's just absolutely ridiculous that they would even consider something like that you can't wear a dang t-shirt in school that says a certain word. It's insulting to me. I would protect public schools, work to protect public schools, work to fund public schools. There's been a certain party that's been in control of the Senate since 2000 and been in control of the Senate and the House since 2016, and they have underfunded public schools, probably half the reason why there's no nurses in schools right now. And so I would work to support public schools. I would like to keep the expansion on the Medicaid as well to include dental and vision. If you've ever been in these rural areas in Kentucky, we absolutely need the expansion of dental and vision in there. I know I've spoke with some dentists and dental hygienists before that there's certain states that allow dental hygienists to work without being in a dentist office. I would like to consider something like that in a rural area. And then I would also just like to focus on rebuilding the working class, get away from this whole mindset that all these large corporations seem to feel like everybody is replaceable. I want to get away from that mindset. I feel like we should support our working class. Everybody should make a livable, a comfortable wage where they can take care of themselves, take care of their families, take care of their homes. Thank you.
Thank you, Jamie. Steve, what are your priorities?
I have several priorities, actually. One is really focused on this nursing shortage that we have. Okay, so with me being working at Elizabethtown Community College, also being in the military, and also being a legislator, I'm seeing a view from different points of view now when it comes to the nurses. As you examine the nursing shortage in Kentucky, I've pulled information from all the schools, and what you realize is that there's no real program out there for people to become a nurse at nights and on weekends. So if they're working a job, they can't leave a job to become a nurse because there's no program out there. There's one program out there at a university, and there's one at one small community college, and that is it in the entire state. With 16 community colleges in the state and 6 or 7 universities, there's no reason why we should have a nursing shortage. We're losing still. If we continue to go produce nurses at the rate we're producing, the gap is going to continue to get bigger. So what we're looking at now, we have some legislation that's going to be proposed actually in a couple of weeks, is the medics to LPN. So military medics, if you're a military medic, and the Air Force already has the program with the Kentucky Board of Nursing where they already meet the standards and meet the rigor of what an LPN is. And so an Air Force nurse or medic can come out and set for the LPN exam and then do a bridge program to RN. What we're meeting with on the 25th is with KCTCS, Board of Nursing, along with Center for Post-Secondary Education and the National Guard, is to look at the military Army nurses and the Navy corpsmen to see what the gap is, to say if you come out of the military and if you went to the training, whether you're National Guard or you're coming out retiring from Fort Knox or Fort Campbell in Kentucky, what do you need to get to the level of an LPN or an RN in Kentucky, and have KCTCS create the program that fills in the gap to allow them to get certified in that program. So one of my other legislative priorities is the nursing home shortage reimbursement rate for nursing homes and shortages as far as the amount of dollars they're getting per person. And as you saw, some of the federal legislation came out where they're putting in requirements for nursing now. I did pass some legislation that allowed KMAs to Kentucky medication aides to be able to give injections on using an insulin pen that's subcutaneous with a nurse available, so a nurse doesn't have to be on site. Because there's the challenge is some of these nursing homes can't keep nurses, and so there's a nursing shortage. So this allows some delegation of nurse responsibilities to a specially trained CNA that can pass medication and give injections as long as there's a nurse available and the nurse does not have to be on site. So that was one legislation that we passed. And I'll continue to look at dental rates. We know that dentists in Kentucky get about $20 or somewhere around there for reimbursement through Medicaid for cleanings. And we know that dental issues turn into healthcare issues in the future. So this is an area that we really need to evaluate, and we weren't able to get it through this session, but it's something I'm going to be adamant about trying to move the needle forward and move the ball forward in this next session to focus on some of the dental stuff. They're grossly underpaid and reimbursed. And what's happened is some of these dentists will not take, and just like some of the in the nursing and the medicals will not take certain insurances, will not take certain Medicaid because they don't get reimbursed for it. They lose money. And it's just not fair to the individuals who we need to be that are underserved in this area. So we need to really focus on what is an adequate amount that needs to be paid to provide the care for the citizens of Kentucky. So I'm very active. I'm very active in my community. I'm very active in talking to superintendents and working with other legislators. So I saw your pen go up. Thank you.
Thanks, Steve. Okay, John, you want to tell us about your priorities?
Going last is fun because I like, oh, that's a good idea, and that's a good idea. And I want to say things that everybody else said, but I'll start with mine. Okay. The two things that I want to talk about, I believe that what we call things is really important. And we have two committees in the state legislature, the Senate Education Committee and the House Education Committee. And we also have the Kentucky Department of Education. But if we change the names to the Committee for Public Education and the Kentucky Department of Public Education, it might help the legislatures that we have up there right now know who they're supposed to be working for, and that they're going to push public education. Jamie's opponent, Steve Meredith, he always says, I have three things I'm concerned about: education, education, education. When I speak to him, I'm like, Steve, you forgot the adjective: public education, public education, public education. So we need to change those names so that there's no doubt what we're doing here. The second thing, years ago, I read a book written by a gentleman named Booker T. Washington, and it's called Up From Slavery. It's an amazing book. It really inspired me when I read it. And one of the things that he talks about is he traveled all over the South, and he met these people from different school boards. And he met this one that they were all excited and proud. They wanted to show him the program because they had increased their school calendar to 5 more days. And when I read that, I wondered, why did we quit doing that? Why, the state law says that it's 170 minimum days. Okay, that might have worked back in like 1940, but it's not 1940 anymore. And we have students that would really tremendously benefit from an increased calendar. So my thing, I'm not going to sit and say, we're going to have a 240-day calendar that right off the bat, but I want to give school districts the opportunity to increase the calendar if they want. And then maybe, we'll see how that goes. Because as it is, when I was a teacher, I would start the year thinking, I have 170 hours to teach American history from Columbus all the way up to the end of the Civil War. 170 hours. And out of that time is taken all kinds of other stuff like pep rallies and sick kids and just a million things, fire drills and tornado drills. And that 170 hours disappears real fast. So I think that we need to give teachers more time to give the curriculum. That way we can brag about Kentucky public schools rather than make excuses for them. Oh, gosh. Yes, ma'am.
Thank you, John. I really, really appreciate that. I didn't miss anyone, did I? All right, great. Thought that the next question belongs to you, April, I think.
Yeah.
But I just wanted to make a comment. It was kind of a question, and we didn't comment on it. And that was, how do we produce more nurses? I think that was one of Steve's comments. What do we need to do? And we do have a solution. And Dolores, I'm going to call on you and ask you to speak to that solution before I let April go.
Okay. Well, I don't know we have the absolute solution, but
we have many solutions, but this is one that we've talked about many times.
Yes. And I think she's referring to building